When most people hear medical imaging, they think of one job. In reality, it's a whole world of specialties, from fast-moving trauma scans to hands-on patient care and image-guided procedures. In this video, we're breaking down 7 major medical imaging specialties so you can see what each one does, how they differ, and which path might fit you best.
You'll see where these professionals work, what their days can look like, and what kinds of skills each role tends to reward.
If you're exploring imaging as a career, this is a great place to start. Let's start with general radiography, often the entry point into medical imaging. This is the specialty most people mean when they say X-ray.
Radiologic technologists create images of bones, joints, lungs, and the abdomen to help providers quickly spot injury or disease. You'll find them in hospitals, outpatient centers, urgent care clinics, and orthopedic offices, which means the patient mix can change all day long. Common exams include chest x-rays, extremity imaging, and spine studies, plus bedside portable exams for patients who can't be moved easily.
That portability matters on nursing units, in intensive care, and in emergency settings, where speed and positioning skill really count. Radiography also gives you a wide range of patient interaction, from routine outpatient visits to people in pain who need calm, efficient care.
If you want a broad foundation, steady demand, and a common starting point that can lead into other specialties later, radiography is often where that journey begins.
From there, a common next step is computed tomography, or CT, where X-ray data is used to create cross-sectional images of the body.
Instead of a single projection image, CT shows slices that help providers see internal structures with much more detail. That's a big reason CT is so important in emergency and trauma care, where clinicians need answers fast. CT technologists may scan patients with stroke symptoms, internal injuries, kidney stones, or complex chest and abdominal concerns.
Many exams also use contrast, so technologists need to understand protocols, timing, and how to monitor patients throughout the process.
Modern CT can also support impressive 3D reconstruction, which helps surgeons and radiologists visualize anatomy in a more complete way.
If you like quick decision-making, advanced technology, and a fast-paced department where every minute matters, CT can be a strong fit. Magnetic resonance imaging, or MRI, stands apart because it does not use ionizing radiation. Instead, it uses a powerful magnetic field and radio frequency energy to create detailed images.
MRI is especially valued for soft tissue detail, which makes it important for imaging the brain, spine, joints, and many internal organs.
But the magnet changes everything about the workflow. Safety screening is constant because metal objects and implants can become serious hazards.
Exams also tend to run longer than X-ray or CT, so MRI technologists need patience, precision, and careful attention to protocol.
They often help anxious or claustrophobic patients stay calm, still, and informed during a loud and sometimes stressful experience.
So this specialty blends advanced imaging science with communication, safety awareness, and a steady approach under pressure.
If you're drawn to detail, patient coaching, and highly specialized imaging, MRI may be one of the most rewarding paths to explore. Ultrasound is different again. It uses sound waves instead of radiation, and the sonographer creates images in real time while scanning the patient.
Many people first think of pregnancy imaging, but ultrasound is also used for the abdomen, vascular system, heart, small parts, and more. Doppler techniques can even show the direction and speed of blood flow, adding another layer of functional information. Because scanning is live, the sonographer has to know anatomy well and adjust probe position, pressure, and angles moment by moment.
That makes ultrasound especially hands-on. You're not just pushing a button, you're actively building the exam as you go. If you enjoy direct patient care, problem solving in the moment, and a specialty where your scanning skill strongly shapes the final images, ultrasound can be a great match. Mammography is a specialized area of X-ray focused on breast imaging and early detection, especially through screening exams.
The images use low-dose radiation and require careful positioning to produce the detail radiologists need to spot subtle changes. Just as important, mammography professionals often support patients who may feel anxious, vulnerable, or worried about what the exam could mean.
So the work combines technical accuracy with reassurance, professionalism, and a calm bedside manner. If you're motivated by preventive care and want a specialty where compassionate communication can make a real difference, mammography has a powerful impact. Nuclear medicine looks at the body in a different way. Instead of focusing only on anatomy, it often shows function by using radiopharmaceuticals called tracers.
After a tracer is administered, specialized cameras detect how it moves through or concentrates in the body. That makes nuclear medicine valuable in areas like oncology, cardiology, and bone imaging, where physiology matters as much as structure. You may hear about SPECT and PET, including PET-CT, which combine functional information with detailed cross-sectional imaging. The workflow can be more science-heavy, with attention to dose handling, timing, preparation, and imaging protocols.
If you enjoy physiology, chemistry, and a specialty that blends patient care with technical and scientific depth, nuclear medicine may really stand out to you. The seventh specialty is Interventional Radiology, where imaging is used to guide minimally invasive procedures rather than just diagnose conditions.
That can include angiography, vascular access, embolization, biopsies, drain placements, and other image-guided treatments. Interventional teams work closely with radiologists, nurses, and other staff, so communication and teamwork are central to the job. The environment also involves sterile technique, procedural setup, patient monitoring, and careful attention before, during, and after the case.
For some people, this is where imaging starts to feel closest to the procedure room and the operating environment. If you want action, teamwork, and a more procedural career path inside medical imaging, interventional radiology can be especially appealing. Now that we've walked through all seven, let's compare the kinds of people each path tends to suit best. Medical imaging is not one career. It's 7 major paths with different rhythms, skills, and patient experiences, and that's exactly what makes this field so exciting to explore. If this helped you compare the options, like, subscribe, and share this video, then tell us in the comments which specialty interests you most. Thanks for watching in the Know Medical Imaging. We'll see you in the next one.